My phone. All right. Good morning, good afternoon, good evening, depending on when and where you are watching this Facebook Live. This is a voice and the face of Dr. Tolu Olabintan, CEO, founder of Living Spring Family Medical Center, here in the amazing city of Mansfield, Texas, not too far from Dallas, for those of you who are looking for a reference point. Please, if you're watching live, hashtag live. And if you're going to watch a replay, please hashtag replay. Of course, feel free to tag a friend who you think would benefit from this live as we're talking about the topic. Doc, I have sickle cell trait. Should I be concerned? Now, just a little bit of info for those of you who are watching for the first time. Why do we do these? I do these lives, or we do these lives to help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And sickle cell trait is something that has come up in conversations with some of my patients. And I'm glad that I'm having this talk with the one and the only Dr. Heather Stanley-Christian. Doc, thank you so much for coming. I appreciate you.
Good morning, and thank you so much for inviting me today. I'm honored.
Awesome, awesome, awesome. Now, that being said, Doc, kindly introduce yourself to our viewers. Who are you and what do you do?
So, I am the director of Unity Maternal-Fetal Medicine. I am board certified in perinatology. I'm also board certified in clinical genetics. So, all that to say, my focus is really on women with complicated pregnancies. And there are so many facets to that care, especially under the circumstances that women are coming. They're often difficult.
Hmm.
And, I think my strength is to help them figure out what is right for them and at the same time give the quality care that they deserve, no matter the outcome.
Awesome. I like what you do. That's why you're on this live. I love what you do. It helps improve outcomes. But for those who are wondering, why do you do what you do? What got you to this niche? Like, how did you get here?
My earliest memory is taking care of my dolls and teaching. And I remember as early as 10, I wanted to become, actually, it was a neurosurgeon. I don't know what I was thinking at that time, but a physician and a teacher. I did a detour in research medicine for a while, did my master's in biochemical pharmacology, but it wasn't until I was pregnant with my only child that I found myself on the other side of the table going, oh,
Wow.
well, maybe this, or maybe I could say that, or, so I ended up in maternal fetal medicine because OB was just a little bit too routine for me. And it wasn't until my mom was older, she'd just go, oh, by the way, you know that your paternal grandmother was a lay midwife in Jamaica. I'm like, really? So it must be in the
In the
genes.
blood. Yes, yes. Wow, wow. I love it. But I'm glad it led you to here. It's so interesting how our experiences they all cumulatively make sense at some point, when you reflect like
Yeah.
where you are, your experiences in the past contribute to that. So I'm happy that you're here. Now let's talk sickle cell disease. I know we're talking about the trait, but what exactly is sickle cell disease and why does the trait even matter?
Yes. So sickle cell is a genetic disease. So when we talk about sickle cell, most people think about the SS disease, but SS sickle cell is kind of a conglomeration of diseases of the hemoglobin that's inherited. So you can have the sickle cell disease that affects structure, as in the sickle cell disease that most of our patients talk about,
Hmm.
or we can have the thalassemias, which affect the amount of hemoglobin in the red blood cells. That is important because the hemoglobin is a protein that takes the oxygen from the lungs. It's in the red blood cell. It carries the oxygen from the lungs to your tissues, and then it exchanges the oxygen at the tissue level, brings the carbon dioxide back to the lungs to exchange the carbon dioxide for oxygen, and the circle continues. Each red blood cell does that in 1 minute. We have 3 trillion red blood cells. So it is a very efficient process. However, if you have the disease where the structure of the hemoglobin is affected because of that blueprint change. So if you think about our genes as a blueprint information, this is how you must make the hemoglobin that must be present in the red blood cells. If there's one error in that blueprint, that hemoglobin function and structure can be affected. It affects how the oxygen gets to the tissues. And when the red blood cells go through the tissues, they go through these tiny little network of vessels. And in order for a red blood cell to go through this tiny vessel, it has to fold and it has to pretzelize and go through. Sickle cell disease, it can't do that. And so they adopt the sickle cell shape, or, the crescent moon shape. And it's sticky, it's rigid, so it slows blood flow, or it blocks or occludes blood flow. And you get all that, the symptoms, anemia, you get painful crisis, you get infections because there's lack of oxygen. And any organ that you can think of, it affects your vision. If you're growing, because it's usually a disease that can be seen in babies. That's when it starts to manifest. So you get infections, the spleen is infarcted. So that spleen that's responsible for infections can't work anymore. Delayed growth, delayed puberty, stroke, even for the guys, priapism, that erection that can't go away, blood clots. So that's why it's important.
Okay. So let's talk sickle cell trait. What is sickle cell trait?
Sickle cell trait is an asymptomatic. So usually it's asymptomatic, no symptoms whatsoever. So let me just step back a little bit and see if I can talk about the basic of genetics. So we have these genes, not the denim, but the GENES, that comes in pairs. So you have to have a pair of these genes to have the sickle cell disease. How do we get these two genes? You have to get one from the mother, one from the father, and those two genes have to come together in the right embryo to affect disease. So a mother can have a trait and she herself is not affected,
right?
Same for that. So that's the trait. Now, unless one parent is doing extreme exercise, they're Olympiads, high athletes, they're doing intensive military service, they live in high altitudes, or they're scuba divers or heat stroke, you don't even know it. Curiously enough, in pregnancy, women who have just one copy of the gene are at increased risk for urinary tract infections. So that is the trait. The issue then comes when you're making babies and you get that combination where that embryo, that baby has two copies of the gene and then therefore has disease.
So sickle cell trait for the most part is not symptomatic. So people don't typically have symptoms or even know, except in extreme situations like you mentioned before. And the issue is when trying to make baby, seeing, sickle cell trait and sickle cell trait, that's when it becomes a concern.
Correct.
Now, is there anything, for those who are wondering, like, okay, is there anything I could do to prevent it?
Well, no. Sickle cell trait was actually an adaptive mechanism to outlast malaria. So the people who had the trait were less likely to die from malaria. So that's why it's passed down, and it's such a strength even today in countries that are affected with malaria. So people with sickle cell disease wouldn't have babies because they've died from malaria, as well as people with normal copies of the hemoglobin gene. So unfortunately, there's nothing you can do about the trait. And I think about 12% of African Americans carry the trait and don't know. It's not something that you will see in the family history, passing from
Right.
grandma to ma to you to child. It it's manifested when you marry into the family or you procreate to create a new family member, then you will see the disease. For people with the disease, so I'm sorry, let me step back. So, folks with the trait,
Right.
if they can get tested, and then if their partners also have the trait, then there are some options available.
Okay, so there are options. Sickle cell trait is not something you can trick because obviously it's genetic, but there are options. I think this is important to emphasize so people don't get bogged down with, oh my goodness, what did I do it's not your fault. It's not something that you did. It's just
Yeah,
what was handed to you as far as genetics. Now,
correct.
when is a good time, would you say, to find out your one sickle cell trait status?
Um,
When is there a good time?
I think as soon as possible,
Okay.
because well, in childhood, it's not so much of an issue.
Right.
In pregnancy, we typically screen for sickle cell trait by using the hemoglobin electrophoresis. I would say at adolescence, because that's a time that, the hormones are raging, people are procreating inadvertently as well as deliberately. And so it would be helpful to know if your mate also carries a sickle cell trait. No, I don't know that there are too many people that would say, well, I'm not going to be with you because you have the trait. However, counseling is very important. If you have the trait and your partner has the trait, there's a 25% chance of those traits being passed on to your child every time you have a child with that mate. 50% of your children will be carriers, meaning they carry the trait, but they
Hmm.
don't have the disease. And 25% of children will not carry any of the genes. So you can roll the genetic dice, so to speak.
Hmm.
If you have the resources, going to a reproductive and fertility specialist where they could do in vitro fertilization, test the eggs, the fertilized eggs, and
Hmm.
select out either the carrier embryos or the normal embryos. That is an option for people who have resources. That's called pre-implantation genetic screening.
Okay. Wow. So you already touched on my next question. So aside from that, if let's say someone comes say, "Oh, I'm married to someone. We found out we both have sickle cell trait, and we plan to have children. Is there anything to do to prepare? Like, what do we need to do?"
Well, I personally believe that knowledge is power. So if that is a situation, there are very nice resources, .edu, .org, CDC, good guidelines, good educational information. Preconceptual counseling is not a bad idea, because we go in detail about the inheritance pattern of sickle cell disease, which is autosomal recessive in nature. Um, there is that. And again, as I alluded to earlier, if you have resources, then using the technology that's available today is something that you could exercise as an option.
Right.
Many states, including your state in Texas, does newborn screening for disorders of hemoglobin C, hemoglobin S, and thalassemia. So if one decides to just go with the natural course of action, then at the time of birth, the babies are screened.
Okay. Okay. I like the idea of preconception counseling. So the couple can go in and just discuss, based on this genetic information or, what I've been told by my parents that I have or this, how can I prepare what I think I should be on the lookout for. What are my options? I think that's a good idea for people to have, especially when there's a known family history of sickle cell trait.
Yes.
Um, yes, this has been very enlightening and very informative. Now, I have someone who's watching who's like, all right, doc, um, I'm going to get screened. I think there's a family history in my family, and I'm well, family history in my family. Sorry, that's redundant. But there's a history in my family. I'm a little nervous. What would you say to them? Words of from especially. What would you say to them? Like, what would you say to them if you could?
Well, I'd probably probe a little deeper to find out what the source of the anxiety is about,
Okay.
and then attach it from that aspect. It is a very manageable disease if you happen to have given your heart and your commitment to a person who has the trait.
Mhm.
There are ways to manage the conundrum.
Okay.
Uh, and I think basically counseling with not necessarily counseling for mental health issues, but genetic counseling will be very informative, because I find that when most folks understand and we kind of dig a little bit into the source of the anxiety, sometimes that does the trick.
Awesome. Awesome. This is good to know. Thank you, Doc. Now, for those who are watching who are like, wow, I like this doctor. I would like to connect with her. I know people who could use her help. Please, where can people find you?
So we have a brick and mortar office in Claremont, Florida. So if you're in the Orlando, Winter Garden, or surrounding areas of Ocoee, you can come visit us. We're at 17323 Begonia Road, Suite 227 in Claremont. We do have a Facebook, Unity Maternal-Fetal Medicine. We do have a website, unitymfm.com.
Awesome. And what I'm going to do at the end of this live, I'm going to have it posted in the comment section so people have access to it and access to you, either to reach out to you to connect for help or to have you as a speaker. So we'll have all that sent or posted at the end of this live. Thank you so much, Dr. Heather. I really enjoyed having you on.
Thank you, Dr. Tolu. It was an absolute honor.
Awesome. Awesome. All right. Thank you all for watching. Of course, do share, tag friends that will find this beneficial. And of course, feel free to reach out to Dr. Heather on her different platforms. That being said, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Dallas, Cedar Hill, Texas area, I am she. Have a good one. And thank you.
Bye. Have a great day.
You too.